way that the entire procedure is performed, I will provide you on your consultation with informative sheets regarding the tumescent liposuction technique. I will have you review all that, read all that, and review it. And then the day of surgery, we will go over and answer over this portion and answer all of your questions. Then we'll do a cursory examination checking your heart and lungs. Then we will take you into the room, the surgical room itself adjacent to the exam room, and we will map the areas that we're going to tumescent. We will take Polaroid pictures of these areas after they've been mapped, and then we'll have you lie down. We will then do preoperative vital signs, which will be followed by vital signs every 30 minutes during the procedure. To prevent patient discomfort, we apply topical ethyl chloride as a local anesthesia, followed by the injection of lidocaine, which provides anesthesia for the adit opening. The adit is a 2 millimeter opening made with a hole punch-like apparatus, and it is used for the infiltration of the tumescent anesthesia as well as the removal of the adipose tissue by means of liposuction. Infiltration is begun utilizing a spinal needle, which is 23 gauge, which is then followed by an infiltration cannula, which is a 16 gauge. This 16 gauge cannula is moved in and out in a fashion to break down additional fat for easier removal by liposuction. This completes the infiltration of the tumescent anesthesia, and in approximately 1 hour we'll begin the actual liposuction technique. This will allow the lidocaine as well as the epinephrine to have their vasoconstrictive effect and numbing effect, but more importantly allow the sodium bicarbonate solution to effervesce the fat so it will be easily withdrawn. And now we'll begin the actual liposuction technique itself. We'll first prep all areas with betadine paint. We're going to start with this real small finesse cannula. It's a 16 gauge, and as you can see, the openings are very small. It's a blunt tipped, although it may appear sharp. It's not sharp on the end. And so we'll start with this. And again, as you remember from my explanation of how the procedure is done, we'll start with the deeper fat and we'll work our way back up toward the skin. And you'll notice here in just a moment, whenever we start sucking some of this out, that it'll be a real white and milky. Is that hurting at all? You can possibly see this. I am often asked how I know when the adequate amount of adipose tissue has been removed. Well, when it becomes blood tinged and it makes kind of a slushing sound under the skin, I know that the appropriate amount of adipose tissue has been removed. After we have completed the tumescent anesthesia liposuction, we will apply pads over the entire area involved and have you fitted with a custom-made garment just for your particular body shape and size. And then you will be sent home having been given a prescription for some antibiotics for approximately 6 days. And then I will see you back in the office approximately 2 to 3 days after this. There is very little pain or discomfort following this procedure because the maximum anesthesia from the tumescent technique occurs at about 12 hours and lasts for approximately 24 hours. So very infrequently do we have to give someone some type of analgesic following the procedure because of the pain or discomfort. I hope that you found this informative, and if you have any questions or concerns, those will certainly be discussed prior to our performing your procedure. Thank you.